Hi, I'm Samantha, and I have a 7-year-old daughter named Daphne who has von Willebrand's disease type 2B severe and thrombocytopenia. Daphne was diagnosed at about 1 year old with von Willebrand's disease. She was not typed for about another 8 to 10 months. We did not also know the severity of Daphne's bleeding disorder. She at first presented with just bruising, excessive bruising, but just bruising nonetheless. And as the year went on, her first year or two, as she started walking and starting to be more active, we started having more severe bleeds. She was diagnosed with type 2B almost about her second birthday, and by that point we had become very familiar with the emergency room. She was having spontaneous bleeding. She would have nosebleeds randomly throughout the day, night, never really made a difference as to when. And every time we would go to the park, we would end up in the emergency room. She was having different bleeding episodes throughout her first few years, and we had always kind of had in the back of our mind that we might be potentially put on prophylactic treatment, but it wasn't something that was at the forefront of our minds because we'd been told it wasn't very common for people with von Willebrand's disease. After about her third birthday, we had a severe bleed that put us in the emergency room, and actually a nosebleed that we didn't know what caused it. It was completely spontaneous, and it ended up being so severe that we got a call from our doctor the next day talking to us about putting her on prophylactic treatment. And at that point, we needed to put a port in because her veins were so small and so hard to stick that they would always have to call in the NICU team whenever she was in the emergency room just to get an infusion for her. At that point, we decided to go forward with being put on prophylactic treatment, and we have not looked back since. Like I said, she's 7, almost 8, so it's been about 5 years that we've been consistently treating her. We do treatment twice a week at this point, every 3 or 4 days, depending. We try to make it consistent, and it has been a life changer for us. We've been able to, leave our little bubble of our being a half an hour from the emergency room because we could treat on demand. It hasn't been perfect, but it's much better than what we were going through before. With Prophy now, we can actually, leave the house and leave our general area, go on vacation, do normal things. It's been a lifesaver with school because she would have bloody noses in the middle of the day, just randomly, and when she was in preschool, we would have to just go and get her and take her home and deal with it and potentially go to the emergency room, however we could handle it. And she has been able to go to school now. She's in the 2nd grade, and we have had very few incidences at school where she needed to be, immediately picked up from school and where she would miss school. We do have a few typical things, like if we do end up in the emergency room, she does miss the following day of school, but that has happened far fewer than we had anticipated. And had we not started a Prophy regimen, we would be in the emergency room quite frequently because she's very klutzy. But going forward, it's important for us to continue with Prophy and for doctors to start putting people on prophylactic treatment because it has been a life changer for us. Daphne's quality of life is so much better now that we can treat at home. She was actually diagnosed with PTSD from going to the emergency room so much. So it's been nice to have mom and dad be able to treat her at home instead of having to go into the emergency room. Going forward, we hope to continue on prophylactic treatment, especially as she reaches into puberty and older, and hopefully have her advocate for herself and being able to say why it's important to her.